this is an intentionally provocative title, Why You Should Care About Drug Policy. I'm not assuming anybody here doesn't care about drug policy, but it is an important topic and an interesting topic to bring to a group such as yours. I really, really appreciate the land acknowledgement that was provided, and I'll just situate myself here. I am an uninvited settler on stolen land. I currently live and am joining you today from the unceded territory of the Cowichan tribe in what is colonially referred to as Duncan. And the Harm Reduction Nurses Association does work with individuals and organizations across all of Turtle Island, and we honor the life force of Indigenous people who have had their land stolen and who continue to resist ongoing genocide. A lot of the work that I do is made possible by people with lived and living experience of criminalized drug use, sharing their knowledge and expertise with folks like me. And so I also acknowledge the immense sacrifice made by people with lived experience to keep their communities alive and safe, and also to share the information that I have so that I can pass it on to others. The Harm Reduction Nurses Association is a national network of nurses with a mission to advance harm reduction nursing through practice, education, research, and advocacy. We do all kinds of things, ranging from we have a harm reduction nursing course through the University of Victoria. We have a scholarship to support nurses who work in harm reduction who want to go back to school. We also were the organization that took the BC government to the Supreme Court over Bill 34. We do advocacy work with affected communities and grieving family members. And we also do a lot of clinical practice stuff like developing or co-developing best practice recommendations for wound care with people who use drugs. And if anybody here has just extra money kicking around, you're more than welcome to donate to the Harm Reduction Nurses Association scholarship. You just got to scan that QR code there. That's enough plugging. Why am I here? Why am I taking up your time? Well, I'm really interested in the intersections between climate justice and drug policy. I have experience both as a frontline nurse supporting people during the heat dome. I worked for the BC Centre for Disease Control for a short period of time where I was on their environmental committee. I did an internship with the International Drug Policy Consortium and spent a substantial amount of time looking at the environmental impacts of coca prohibition in the global south. And in my master's, which I just finished, I spent a lot of time also examining, first and foremost, the policy implications of mis and disinformation, and also the intersections of climate justice and drug policy. I also care because I care about the people that I work with every single day. And this video, which might work, hopefully works, shows a makeshift misting station that we created when the heat dome hit Victoria, because we were notified by the city of Victoria that there would be no cooling stations provided to people who were unhoused. And so a group of us bought a tent and a sprinkler, and we actually used the city of Victoria's water source right at City Hall and created a misting station. And it was a really eye-opening experience about the way that people who are furthest in the margins are also going to be the ones who are left behind in this ongoing and worsening climate crisis that we're seeing unfold before our eyes. The thing about wicked problems is that, when people talk about the climate catastrophe being a wicked problem, people talk about homelessness being a wicked problem, about drug use and overdose being a wicked problem. If you look at the criteria for a wicked problem, you'll see oftentimes that there are hard to define solutions, hard to define problems, no consensus on measurements for success. And you also understand that at the root of the problem is oftentimes an even bigger problem. And so harm reduction is under attack right now. And I'm kind of on a mission to try to find ways to broaden the umbrella, to gather more support, to strengthen solidarity between movements. In the name of fiscal responsibility, policy is being advanced that jeopardizes health and safety of individuals and ecosystems right now. And we have common ground. There is strength in solidarity. And my favorite meme is the Scooby-Doo villain mask reveal, And when you look at the climate crisis and you look at the overdose crisis and you look at the housing crisis, you often see some of the same root problems: neoliberalism, colonialism, extractive capitalism. This isn't a hot take from me. This is something that's actually been studied quite extensively. And so I'm happy after this short presentation to put these links into the chat, but showing two really important reports that were published in the last 3 years. The first one on the right, revealing the missing link to climate justice, drug policy. Oopsies. In this one, it was really emphasized that criminalization forces drug production and trafficking into remote, biodiverse, and protected areas. There's a lot about the experience Colombia has had, where they participated with the United States in the war on drugs, dropping glyphosate off of aerial bombers onto coca fields and decimating ecosystems. And the ultimate result was that illicit farmers just cleared more forest and moved further into harder to reach areas. And that's what they call the balloon effect. They also note that profits from illegal drugs are reinvested into other harmful activities like illegal mining, logging, wildlife trafficking, and land grabs. The second report, the one to the left, From Forest to Dust, really highlights that enforcement and eradication efforts, particularly about coca cultivation, actually spreads environmental and social harms, and that deforestation for coca cultivation and clandestine labs accelerate ecosystem fragmentation and climate change impacts. And so, because I only have 10 minutes and I'm almost at the end here, I just want to part with a quote and then a little bit of an olive branch, in that I would love to work with you all. And I care deeply about the environment. I also care about harm reduction and about people who are dying by the toxic drug poisoning emergency. There's a great scholar by the name of Tim Rhodes, and he's published a number of studies and essays. And this one here is called Ecologies of Drug War and More Than Human Health, the Case of a Chemical at War with a Plant. And he says this leads us to outline a more than human approach to harm reduction, a harm reduction which positions health as a matter of ecology, paying attention not only to non-human actors affecting human health, but also to the health of environments, which are themselves always in the making. We envisage harm reduction as a collaboration in which humans become with their environments. And so, yeah, I offered to come by and share a little bit about kind of what I was thinking, and see if there's any opportunity or interest in collaborating down the road. We're always around, and I really appreciate your time today. Thank you.
Thank you, Corey. I'll leave time for some questions. Maybe we have maybe 3 minutes for questions. Any comments that you have for Corey from the group here? Go ahead, Bethany. Yeah.
Sure. Yeah, my question, I'm not sure if we talked about this when we met, Corey, was how much talk do you hear within your work world of harm reduction about the harms of climate on the populations that you're working with, or other environmental impacts, particularly thinking of things like that heat dome event? Are people really upfront recognizing that, hey, we are really affected, sector, and this is a cause of climate change that we can speak publicly about? Or is it more like this is just an emergency we have to manage in the moment, and is that connection being made?
Well, I mean, I think that there's a number of people who have sounded the alarm about the disproportionate impact we will see on people who are unsheltered, who are unhoused, who experience serious mental health challenges or substance use related challenges. We've had presentations at the HRNA from nurses from the BC CDC about how to keep people safe during the heat dome. But it's very downstream, the efforts, right? It's like, what do we need to do in this moment? How do we keep people safe for the next 3 days of heightened risk? And when it comes to structural changes that would actually reduce the risk and prevent the risk, as with many things related to homelessness and drug use, they tend to get backburnered, especially in the context of this austerity period that we keep hearing from policymakers, that there's no money for things like this. And so yeah, I would say that there's a lot of awareness, especially on the front lines, And also, we've noted little motivation to address.
Trevor?
Thanks. Hi, Corey. A couple of quick things. I've just popped in the chat a quote that sort of complements in some ways the quote you used from Rhodes. I thought you might like it if you hadn't seen it, about reconciliation with the earth from the Truth and Reconciliation Commission. But the other thing was, I've just been talking recently with David Hollingworth, who's with the Climate Change and Environment Committee of the Ambulance Paramedics of BC. And it occurred to me that you might, certainly your work would overlap with them, and I don't know whether it would be useful for you to connect with them in this context.
I'd love every opportunity. I think we as movements, and I won't speak about the work that you're doing, but I've seen a lot of siloing and a lot of people kind of being picked off one at a time, and so I really want to help find that common ground so that we can show, and that means people who care about drug policy showing up for climate justice as well, and how to reciprocate and strengthen that solidarity. So any connections, anything that you think would be useful, I'm here for it, and I'll put my email into the chat. And thanks for putting that quote in there, Trevor. That's really great.